Hello, my name is Bruce Potenza. I'm currently the director of the Burn Center at the University of California Medical Center in San Diego. I'd like to welcome you here on behalf of the American Burn Association and thank you for time to come to visit us here at the Burn Center. I hope that our tour will give you a little flavor of what we do, what we see, and how we do it, perhaps give you some ideas to take home and use at your institution. Likewise, please feel free to share with us some of the suggestions that you have of how you do things differently or better at your institution. With that being said, I'd like to tell you a little bit about the Burn Center here at UCSD. Since 1973, we've provided continuous care to the residents of San Diego County and Imperial County. At the present time, we remain the only burn center serving both of these counties. We provide state-of-the-art burn care, both acute, rehabilitation, and for reconstruction. As a result of our team's effort here at the Burn Center, we have some of the best outcomes and speediest recovery for burn patients. These main factors have earned us recognition as a world-renowned burn center. We have developed many advanced systems and products for treating burn patients. Particularly with our former director, Dr. John Hansbrough, we worked on materials to enhance the healing of wounds, and with the help of industry, developed the product called Transite, which is widely in use at the present time. Although there is a short break in the manufacture of this product, it's our hope that this comes back soon, as we find this very effective in treating pediatric burn scald victims and facial burn victims of partial thickness degrees. Here at the Burn Center, we treat between 300 and 400 patients a year as inpatients. We do between 250 and 300 inpatient surgical procedures. On the outpatient side, we see about 900 to 1,000 new patients a year. Today, I'd like you to meet some of the members of our burn care team who will tell you a little bit about what they do in the care of the burn patients here at UCSD. I think that you'll find this interesting as they give you a little personal insight as to how they help make these patients achieve the best outcome that they possibly can.
We have a full-time wound treatment and research center at the University of California here in San Diego, and we treat every type of wounds, diabetic, pressure, ischemic, arterial, vasculitic, and we provide a full service from seeing the patients to the wounds to doing surgery when necessary on any of those wounds as well.
I'm Mayor Tenenhouse. I'm one of the plastic surgeons here at UCSD, and I've had a long history, I think, here. I did my burn fellowship and critical care fellowship in the early to mid-90s. Went on to do my plastic surgery in New York, and then was recruited back by John Hansbrough to do the burn reconstruction. It's been an incredible ride for me, a great experience. We're very fortunate here. Not only do we live in a very beautiful city, but we're surrounded by absolutely terrific people.
I'm R.B. Manassian. I'm the psychologist at the Burn Center, and today I want to show you one of our technologies that we use for managing pain in our burn patients. This is our virtual reality system, and virtual reality is a computer simulated environment, a three-dimensional environment that our patients can engage in. And the idea behind it is that it's a sort of the ultimate immersive distraction technique that distracts patients from their pain during painful procedures such as dressing changes, physical occupational therapy. Actually, the first folks who developed the use of virtual reality for burn patients are Hunter Hoffman and his colleagues at the University of Washington Burn Center. And we've actually replicated their findings that patients who use virtual reality during dressing changes and physical occupational therapy actually end up having relatively decreased pain levels.
My name is Dr. Grace Dankwa, and I'm doing a one-year fellowship in burn and critical care at the UCSD Medical Center. I've been here approximately 1 year, and this has been a very good experience for me. First, in terms of the outpatient experience and the amount of patients and the variety and the volume we get in the outpatient clinic. Next, also in terms of the ICU care and the critical care, we are the biggest regional burn center in Southern California, and the amount of patients and the variety of patients we had is just extraordinary. I have really enjoyed being in this burn center, and I'm sure you will have a great time today touring this center.
My name is Gail Liu, and I am the Critical Care Burn Pharmacist to the Regional Medical Center Burn team. To my right is Frank Chu, who is a second-year Critical Care Pharmacy resident, and to my left is Kelly Stadelman, who is a first-year General Practice Pharmacy resident.
Hi, I'm Janine Dabino. Welcome to UCSD Regional Burn Center. We have 30 years of excellence in our history. We have an 8-bed ICU, a 10-bed step-down unit, and a clinic that's available 24 hours a day. The excellence of this unit is by the staff who work here.
My name is Jason McSweeney. I'm the nurse practitioner for the Regional Burn Center here at UCSD. I want to welcome you to our ICU. I've been working here for approximately 5 years. I've been in San Diego for about 10, and I've really liked working here. The people are great. It's a great teamwork. We have a multidisciplinary approach to the patient care that's somewhat unique and satisfying for both the staff and the patients.
It's an exciting time for us. Our burn unit's expanding, we're growing. I've got a very busy lab. Hopefully shortly you'll meet some of my colleagues in the lab, Dr. Dhaval Bhavsar and Dr. Lars Evers. Dhaval is from India. He's a fully trained plastic surgeon, spent the last 3 years with me doing clinical and basic science research. Lars Evers is a plastic surgery fellow from Germany, and he spent the last year and a half or so with me.
I'm Dr. Bhavsar. I'm a fellow with Plastic Surgery Research Laboratory here at UCSD, and I've been working with Dr. Tannenhaus on the projects related to burn and burn wound healing, as well as burn physiology for the last 3 years. It's an exciting field. Like, burn affects a lot many people and a lot on the healthcare economics, as well as the load on healthcare is great. Our primary motto is to see if we can reduce the burn injury in a systemic way, as well as locally on the burn wound, and how to better treat burn wounds. Our primary goal for the last couple of years has been to see how burn wound affects locally in terms of the progression of the wound injury beyond the primary focus of like burn, as well as systemically what happens to lungs, gut, and other organs in the body.
My name is Dr. Lars Evers. I'm a plastic surgeon in training. I was trained in Germany, and now I'm almost 2 years here doing burn and plastic reconstructive surgery research here with my boss, Dr. Tannenhaus. He's also my colleague, and he's already my friend. So we have a really good time here. Our research is focused on different projects in burn-related research, for instance, burn apoptosis research. So right now we are doing some animal model research where we were already pretty successful, and now we try to convert it into clinical research that we can really help the patient in our BICU.
My name is Glenn Redovan. I work in the burn ICU for 27 years. I do precept newly graduate nurse to the burn ICU. I orient and mentor nurses and medical staff to the burn ICU. I do sign off their competency, and I'm also part of revising and updating the burn standard for the burn ICU, and I'm also a relief charge nurse for the burn ICU.
My name is Fiona. I'm an RN on the burn special care unit. I was actually a case manager for 15 years and used to cover the burn unit, and decided to come back to bedside care because I missed the patient contact, and this was an excellent unit to choose because it's a specialty, and the camaraderie here and the staff that work here are exemplary, and I'm proud to be a member of this unit.
Hi, I'm Grace Delap. I'm a nurse here at the UCSD Burn Center in the Burn ICU. I've worked here since '99 as a traveler and now officially as staff.
My name's Leanne Cordomia. I work here in the outpatient clinic. The outpatient clinic works to take care of the urgent burns that come in and also the follow-up for our patients that have been admitted. 60% of our caseload in the clinic is children, the other is adults, and that's what I really enjoy about the clinic, is taking care of the kids. One of the things that UCSD Medical Center is really good about is community service, and we're very involved with doing follow-up with the schools. We do a lot of burn prevention with youth groups, teaching in the high schools about health careers. I'm on the coalition for juvenile fire setters here with the fire department and the Burn Institute locally. We have a burn survivor support group that we're real active with. And that's something that we do really well here at UCSD Medical Center, is a lot of our staff is very involved in the community, and that's what I like about working here.
My name is Sarah Hershel. I am the primary physical therapist on the burn unit here at UCSD Medical Center. I've been here for about 3 years, and I find this team great to work for. The job itself is very rewarding.
Hey, I'm Jamie. I'm an RN on burn special care. I have been up here for about 2 months, and I love working with the burn team. It's a great place.
Our primary role is to work with the burn surgeons and the rest of the ancillary team to take care of all the burn patients that we see in the ICU, on the floor, and in the clinic.
So this is the virtual reality system, and we have Neil playing one of our games. This is the Street Luge game. We actually have 2 games. This is the game that we use for our adolescent patients and our adults, and then we have a game for younger children as well. Neil is wearing a helmet, operates the environment with a joystick. If he looks up and around, his point of view changes with head movements. So again, the idea being that this is a very immersive environment that allows the patient to sort of take their focus away from their pain sensation and distracts them from their discomfort.
Our burn center was started by a father and son team, the Frank family, and they did an absolutely beautiful job developing a burn center in an area that had a great need, was a rapidly developing city, and their efforts were absolutely tireless. After that, John Hansbrough came from Colorado, and John was a great friend and a mentor for all of us. Really, I think, brought this burn unit into just worldwide acclaim for his work in research, biologics, biosynthetics, the development of transite and other modalities that so many of us use regularly.
We have a large variety of wounds. We have all the ancillary services and a lot of support from the other teams as well. So if patient needs care outside of just the wound care and related surgery, we also have vascular service, plastics, orthopedics, as well as numerous other services which are at our disposal almost on immediate demand.
My name is Carolyn Sandlin, and I've been associated with the burn unit in some way since its conception. Dr. Hugh Frank is the one that actually established the burn unit here, and he asked me and my parents to help with the burn garments way back in 1970s. I've been doing it by myself now since 1978, and I'm the one that does the burn garments for all of the people here in San Diego County.
Hi, my name is Emeka Anyanwu. I'm a burn technician at UCSD Medical Center Burn Unit. I am a burn survivor, and the reason why I choose to come back here after my injury is because of the experiences, the good experiences that I had when I was a patient here. I was born in 2004, admitted here at UCSD Medical Center Burn Unit. I was here for 28 days. And after my experiences with the nurses and the doctors that I work with right now, it was quite an experience to come back here and give back the good, caring, the patient, the whole medical involvement that I went through, that I wanted to give back to other patients that come here so that they will be able to experience the good part of UCSD Medical Center Burn Unit that I went through. I'm happy and glad, and I'm grateful for all that that was done to me, and I'm glad I'm here as part of the team to give back to the patients and to cherish that commitment and that unity that we have here in UCSD Burn Unit.
My name is Brenda McFarland. I'm a respiratory therapist here in the burn unit at UCSD Medical Center. I love what I do. We have a great burn team here. One of my principal responsibilities is airway management, ventilator management. We receive patients from all over Imperial Valley. We are the Regional Burn Center. It is an exciting, exciting position. I'm so grateful to be a part of the burn team. I have been here for 8 years, and I wouldn't want to do anything else.
My name is Laura Sutton. I am a clinical research nurse here at the UCSD Regional Burn Center. My role is to conduct studies for both in-house and commercially sponsored clinical research trials. In addition to clinical studies looking at new medications, we have ongoing in-house studies that monitor the incidence of comorbid diagnoses of our burn patients. Two measurements we are presently tracking are the incidence of DVTs and the infection rate associated with CVC lines. It is through research that we were able to find new ways to treat burns as well as improve the overall care of our patients.
My name's Malo. I'm the Assistant Nurse Manager here at UCSD Burn Center. I've been at the U probably for about 14 years. I came as a traveler from Canada, and I really love San Diego. The weather's great. I know we pay $10 in mortgages, but it's worth every single penny.
My name is Linda Lum. I'm a clinical research nurse for the Wound Treatment and Research Center. I work with Dr. Mulder and the staff to enroll subjects into clinical trials for chronic wounds, such as diabetic foot ulcers, and to perform study procedures.
My name is Tony. I'm one of the burn technicians here at the Regional Burn Center. I've been here for 14 years. I handle the dressing changes.
The wound clinic is part of the Regional Burn Center, and we work very closely with them so that not just burns are seen in our department, which is the Division of Trauma, but we're also capable of seeing patients with other types of wounds as well.
My name is Violet Reyes. I've been here in Regional Burn Center for 20 years as a burn technician. I enjoy what I'm doing, a patient care and a wound care. I enjoy working with my coworkers.
My name is Jeff Hebron. I'm a social worker here on the burn unit at UCSD Medical Center. Right now I'm a social worker dealing with discharge planning, looking for SNFs, doing bereavement counseling and so forth. Glad to be here working with a great team at the burn unit.
Hi, my name is Joanne. I am a new nurse to the burn unit and I love San Diego.
I'm Nancy Copeland. I'm now an RN working at the burn center here at UCSD. I've been in here for 20 years. I started out here as a burn tech, so I've really kind of like gone through the whole continuum of care. Got my RN about 4 years ago, and I really just love working with burn patients.
I'm Pat Choothesa, the Managing Producer Director here at the Division of Trauma, Surgical Critical Care and Burn. My role is to support the division by producing educational programs, both online and interactive media presentations.
This is Scott. How are you? I've been here 14 years. Love San Diego. It's a great place to work. It's great to see people come in here critically ill and see them walk out of here a healthy, well-adjusted person. It's really a great place to work. Love San Diego. Love the beaches. Love the food. Love the people.
My name is Gina Olson. I'm a hospital unit service coordinator here at UCSD Burn Center. I work here for 2 years now, and I love the unit. The nurses here are great. It's a great unit to work. The nurses really take good care of their patients, and the patients come in severely ill, and they leave. A lot of them leave healthy and walking and coming back for clinic appointments, and I get to see their smiles again. So it's a great place to work, and I love Burn ICU.
I'm Tuan, a physical therapy assistant here. Work here since January. Usually burn survivor. I'm a burn survivor. Dr. T is the doctor, my plastic surgeon. Love all the staff here. Like to be here. Love to work here.
My name is Sheila Rouse, and I've worked for UCSD for 10 years. My role here is as a respiratory therapist in the burn unit.
And we do all of the adjustments that need to be done at the burn clinic right here with our sewing machines every single week. And what we're doing now is that this particular patient had a few problems and the little blowouts on their garments, so we're fixing them so that we can have them still use the garments now instead of having to get new ones, so it's cost effective for both the patient and for UCSD.
Well, our time is drawing near to go ahead and start our tours. We thank you again for coming to visit us here at the University of California Regional Burn Center in San Diego. We hope this video has given you a little flavor of what we're about, but more importantly, what the people are like here at the Burn Center. And like always, My burn staff is now reminding me that they have a few things to say before we close this. So with that, I will sign off and say, welcome to San Diego, enjoy your tour, enjoy the ABA. And now the staff has a few final parting comments for you. Goodbye.
Welcome to San Diego.
Welcome to UCSD, and I hope you enjoy your tour.
Welcome to San Diego. Hope you have a good time. Go to the beach.
Welcome to San Diego. Hope you have a great time. It's a great city.
And I hope you absolutely enjoy your time here in San Diego.
Enjoy your visit.
I hope you really have a good time here.
Have a pleasant stay in San Diego.
Take care.
See y'all.
And thanks for coming to visit.
Thank you.
Welcome to San Diego.
Which restaurant would you recommend to those folks from out of town?
Oh, Pat, I don't go anywhere.
Yeah, Pat's restaurant. It's excellent. It has the best Thai food in San Diego.
Would you like to say anything else?
No, I'll think about it and then I'll come back again, Pat.
I forgot already. That's it.
What is your name?
My name is Grace Duck. Start again.
Welcome to San Diego. We are the UCSD